Broadcasting from the business capital of the world, this is the Podcast Business News Network.
And welcome back, everyone. We all love our pets. And when they're not feeling well, they're ill, they have challenges, we want to make sure they're comfortable and take care of them. We're going to talk with somebody who is a pioneer in the field of canine physical rehab in the state of New Mexico and learn more about animal rehabilitation when it's needed, what actually happens. She is fantastic. Dr. Laura Hady joins us here on the program. Hi, Laura. How you doing?
I'm doing great today so far.
So far, it's going to be a great day.
Oh yeah. You never know what walks in the door, right, Steve?
Well, you know that I'm always looking at the positive, and you become what you think. However, when you say walk through the door, interesting way you put that, because you're there to help uh, pets and their person, and you never know what you're going to get, right?
Right. Exactly, for sure.
Wow. When we talk about rehab, yeah, we try to put that, in a human perspective, but looking at it through the eyes of a veterinarian, what are we talking about here?
So basically what we're talking about is the human equivalent is physical therapy. We're not allowed to use that terminology with animals. It's actually a trademark name. So my patients may come to me with arthritis because they're aging. They may come to me from an injury. They may have some other issues going on, such as a disc disease that's preventing them from walking. And I deal quite a bit with sports medicine animals that do agility or scent work or barn hunt or hunting, and they need to be at the top of their performance after an injury and get moving to the best of their ability. We even have a few sheep and goats in our premises for braces, just to get them up and walking after weakness and surgeries.
Wow. Okay, let's talk about the performance animals, if you will, but with a couple of examples of who they might be. Get specific if you can.
I work with, in New Mexico, we actually have a little hub for high-end agility dogs that make it to national competitions, such as the Purina Dog Challenge, and also nationals in Florida each year. So we may have, out of our small area and training center, 23 animals and their owners go. So I work with owners and trainers, agility trainers, such as Kim Terrell and her dog. I haven't worked with them, but her dog Steeple from a groin injury, a muscle tear. I've worked with other animals post knee surgery, particularly in border collies, Australian shepherds, and some we're dealing with a German shepherd right now who has elbow arthritis and is only 4 years old, and what we can do to make them feel the best, and do they need to be referred to a surgeon for extra help.
So does it work both ways? Does the surgeon come first, then the rehab, or it can go, like you just said, it can go from the rehab and then we need a surgeon?
When I first started, I relied on referrals from surgeons, mostly post-orthopedic surgery, such as knee surgery for a ruptured cruciate, or back surgery after an animal blew a disc, such as a little dachshund. And more, what I'm finding is, with the shortage of veterinarians and specialists, sometimes the family veterinarian will ask me to look at an animal first so that I can give a referral to a surgeon. And then after surgery, they'll come back to me. What I tell owners basically in those situations is, what we're going to teach you and what we're going to do with your pet is going to benefit them before and after the surgery, and sometimes for the rest of their lives.
Is the anatomy of most animals similar to humans? By that, I'm talking about, obviously, we don't have four legs, but I'm specifically talking about the muscle, the bones, the tendons, and all of that.
Some things are super similar. There's a few exceptions. Because animals walk on all four limbs, they can weight shift easier to either the front end of their body, which bears 60% of the weight normally, and the back end only bears 40%. Whereas humans, we're straight up and down. And so we don't have to bear weight on our elbows, for example, or our shoulders. In an animal, their center of gravity is actually right behind their shoulder blade, whereas humans, being bipedal, our center of gravity is near our pelvis.
Wow. What's reasonable expectations when you work with an animal and rehab? And is that rehab, physical therapy, is that similar to what we know as adults, humans?
Exactly. I had, there was a veterinarian who hired a physical therapist 20 something years ago, and she started a small business. And I sent animals over there, and I saw good results from what she was doing. And so I thought, man, there's a huge gap in healthcare in animals for this type of service. Then my own animal, my dog Bucky, he was a small Australian puppy, and he got hit by a car in a freak accident, fractured his spine, and my husband and I worked tirelessly to recover him. And we've had so many other rescue animals through the years that I drew from my own experiences with needing physical rehabilitation myself, as well as with my own animals.
Wow. Tell us, Laura, about your journey. How it got you to where you are doing rehab for animals.
I started out as actually a mixed animal veterinarian in Idaho, and moved back to New Mexico because I was homesick. And I practiced for 8 years in private small animal practice. And you just about that time, they always call it the 7-year itch in marriage. Well, I was getting the 8-year itch as trying to find my specific niche in veterinary care. And just following that veterinarian and her journey, then miraculously a program started out of the University of Tennessee to provide training and credentialing. And then my own animal being hit by a car, it just all came together, and I had to make the push. Can I do full-time regular vet practice and full-time rehab, or should I just focus on physical rehabilitation? And so I took the step out from being employed to being self-employed. And it was scary at times because I wasn't sure where things were going to move.
It's so unique. I've never even considered that rehab exists for animals, but it would need to
Yeah.
because of, injuries and surgeries and all of that. So a human knows why they're going to a therapist. Animal doesn't. So do you encounter challenges there with working with animals?
Yes, I do. The most interesting part is I try to get a feel from the owner what their goals are and what they want to accomplish. Usually it's more comfort and more mobility. With the animal, we do a lot of nonverbal communication as soon as I meet them. So I'm speaking happily to them. I'm offering them turkey for treats. I'm petting them if allowed. And
Mm.
me and the animal start to communicate and have a rapport so I can do my exam, try to let them know I'm not going to hurt them. I'm a friend, not a foe. And in the meantime, as soon as I finish that, now I have to shift gears and communicate with the owner what I feel is going on and the best ways to get to our goals.
Have you been in situations where the animal's just not having it? And you can't do your job because they're resistant.
Yes, and we've especially experienced this post-COVID. So during COVID, during the lockdown, a lot of people adopted animals because they were home more from the shelters and they were lonely. So
Oh.
they adopted these animals, and unfortunately, they couldn't go to dog parks. Vet appointments were scarce. They couldn't take their dog to the store, even in some situations on walks. And so these animals were not well socialized with people. And so afterwards, even in traditional veterinary medicine, these animals don't want to be touched, and they're very scared of you. So I just work very, very slowly with them, and I find out what motivates them, whether it's praise, whether it's a treat. Sometimes I can't do a full exam. So, for example, I can't get the range of motion in an elbow. I have to just say, we'll get that another day. And there's certain breeds, certain herding breeds that don't like their feet touched. You can think of healers as one example. I worked with an Akita yesterday, so I was very careful with her about touching certain areas of her body. Huskies are another breed that don't really like you to touch them. So sometimes we have to go to straight hands off and start making things into a game so that as soon as they find out it's a game, then they start to have a lot of fun.
You must have amazing patience.
You have to, and you have to know a lot about behavior, dog behavior as well, and people behavior. Fortunately, I work next door. I used to work next door to a veterinary behaviorist, Dr. Nickel here in town, and he always offered insights, and he would just laugh at me, with my turkey and the things I would say to the dogs to get them to do the exercises. It's hilarious.
So I've spoken to and done podcasts with a number of animal communicators. And I know that some think it's a little woo-woo. I'm always skeptical, but I've seen it in action. And I don't know how they're doing it. Do you feel that you have some kind of vibe with animals that, in so many years of doing what you're doing, Laura, that they kind of pick up on what you're sending?
Oh, definitely. I grew up with a lot of animals. I was raised in a family of 14 children, and we had just every kind of pet you can imagine. And so I grew up playing more with the animals than my brothers and sisters sometimes. And then just always owning animals. And I love to watch animals play. So, yeah, I do feel. And the other thing for me is what I have to do is I feel I need to touch the animal. And sometimes that's not always welcome, but I get a good feel for what's going on because your diagnosis is very important because your treatment's only as good as your diagnosis. And so there's times when I really have to touch the dog to get a feel, watch them move, talk to the owner about how they're doing at home.
Hmm. It's almost as if you're like a CSI investigator. You got to put the
Exactly.
pieces together. So now you know what the nature of the beast. I guess I could say that this time, and then move on from there. Now, um, canine physical rehab is what we're talking about, but you mentioned other animals as well. So you do. It's wide open.
Right. I see second in line would be cats. Cats, you have about 15 minutes of an appointment to really work with them and then they shut down. You can try to feed them tuna, you can try to do anything, try to kind of move them along in their harness, but then they stop. Luckily, I've had cats all my life and I set up my equipment and my cats get on and off so I can find out what they like. I've done rabbits. We've also, with nerve issues, we got a tortoise on our underwater treadmill when I worked in the emergency clinic. And then obviously working with sheep and goats as well. I just I love all animals, so
Wow.
it's fun to see what it's just like problem solving. So I get to figure out how I'm going to approach them each day.
What issue would a rabbit have?
Well, they can either have trauma. If someone got in their cage, they can have a parasite that causes their spinal cord not to work properly. And sometimes they'll get nerve damage. And rabbits tend to be very scared of new situations and new things. So we have to work very slowly with the rabbits.
Do you find that when you do an examination, you can almost feel what's going on?
Yes, you do. And that partly comes from being a traditional veterinarian, knowing what your exam is, listening to a heart, feeling, watching the animal move. You have to put so many different things that you're seeing, hearing, feeling all in together to get an idea for what's happening with that animal.
Ultimately, why did you pivot from traditional veterinary work into the rehab? What was the moment that you discovered that that's what I'm going to do?
I've always loved and enjoyed exercise, and I needed to slow down. In my veterinary career, I was having some infertility issues, and I needed to be able to set my own hours to and relax more about things. And it was just a natural following of events that occurred. And my mentor, from Colorado State University, an orthopedic surgeon named Dr. Peter Schwarz, had decided he was going to move back to New Mexico and open a state-of-the-art surgery and specialty practice. And I called him, and after my dog had the fracture, and I said, "Hey, do you have extra room in this place for me to open a business?" And he said, "Sure." And so
Wow.
we kind of tag teamed that together with a lot of encouragement from other mentors in my life, for sure.
I could see, looking at the veterinary side where it's more immediate. Somebody comes in, could be an emergency. There's more, I would think, more pressure than the rehabilitation side of things.
Mhm. And luckily, I've got to live on both sides of that, where
Sure.
it was the emergency, and then, but I've got to be that after the event person who starts to move really slow with them, and builds trust with them, and takes care of the surgery may last, 2 hours, but the recovery is going to be 8 to 16 weeks. And so it's nice to be on both ends of the spectrum. If I hadn't have worked in that emergency clinic and with the surgeons, I don't think I could have ever had the huge load of cases and the variety of cases that we saw. That makes me so much more confident and experienced when I see animals today.
Arthritis can be a big deal.
Yes.
What animals, and if we can get specific, I'd love that, are more prone to arthritis or even breeds than others?
Right. So obviously dogs are more prone to arthritis, although cats can have it and not show it as well. So obviously we like to think of the Labrador Retriever, that's had a very active life, but it can be anywhere from the Chihuahua I had to a Great Dane as well. And so we have to protect those joints even kind of ahead of time before they age, with proper exercise, keeping the animal at a proper weight. And then we can talk about drugs and other things that can help them.
Well, now you mentioned weight. Is that a really big factor in the health mobility of animals?
Yes, it is. Well over 25% of our animals are overweight and obese. And so it's always a delicate conversation with the owner, because they feel like, especially if they're gone long time away from work, or the easiest way to reward that animal is with food. And we have to tone it back. Maybe your animal just needs your time at the end of the day to play with them for 5 minutes, and hey, this food contains this amount of calories. Maybe let's cut this back a little bit, and do some fill time with some water or other nutritious treats.
In terms of exercise, I'm glad you said that word. So let's say, somebody has a dog. What's your recommendation for the amount of exercise that a dog should get? Humans, we always hear, what we should be doing, but what about pets?
It depends on their age. Obviously, if they're still growing, you don't want to run 5 miles with them every day. Right now, I have three 6-month-old dogs. Two of them are Chihuahuas. One's a Heeler Cross, and we walk about a mile every morning when it's cool. And we play different games during the day, like hide and seek for treats. And so it's not always about straight walking or hitting the pavement. It's more about spending time with them and activity.
So many times they say that you should, um, as a human, sprint, then slow down, and sprint
Mhm.
and slow down. It's just better on the heart. It's a better cardio workout. Um, would it be the same thing for a dog?
Not necessarily. So some of the injuries that I see are from throwing the ball or using the chuck it at the end of the day. So you're able to throw the ball a lot farther, that the animal runs down to the end of the lawn or whatever and makes a sharp turn and brings it back. And you may do this for 10 minutes straight just to burn energy off the dog. And unfortunately, that hyperextension and those rapid turns can be detrimental to their joints.
Wow. So doing it, a few times is okay, but not
Yeah,
repeated?
yeah, rolling the ball, taking it a little slower, or just plain old walks. There's certainly some breeds that in agility, it's what, 30 seconds of pure adrenaline and movement and rapid movement and turns. And then that's it. So we have to make sure their core muscles are there, that their balance is really good. That they know I may break down a jump over an object into 10 different steps to explain to the owner what muscles they're using when and how we can make best use of those muscles if the turn doesn't go exactly right for that animal during an agility trial or run.
I have to believe that there have been rehab situations from animals that were just exercising with their person.
Mm-hmm.
Yeah.
Yep. I always tell people it's like my sciatica can flare up when I step off the step wrong.
Yeah,
It's
I
not
get
as
it.
simple, or we can have dogs that have back problems, little dogs that just jump off the couch. It's just it's not fair, but it happens.
Oh, I get it. I'll jog. I'm not a fanatic about it, but I like the cardio involved in it, and I like seeing, out. Never get any injuries from that. And a couple of weeks ago, I was at a concert venue, and I just was going down some steps, and the next day, my ankle's like, and it's still getting a little bit of discomfort there, but to the point where, I could be doing this with no issues, and the silliest little thing, you step a funny way, and it's like,
Exactly. And that goes into how important rest is. Some owners are very scared about crating their dog or not moving with their dog, but that dog needs rest. And so where I can come in and help them is have brain games for the dog to do, where we're not doing the wrong kind of activity, but we're keeping the dog mentally stimulated and the owner to a certain extent mentally stimulated.
wow. Um, I'm learning a lot today, and part of that, Laura, is now I'm feeling guilty. I have to take care of my dog more. Yeah. And do the right exercise more, and then stimulate his brain. They're so smart, and we're so busy, but you have
Mhm.
to find the time.
Yeah.
How does somebody learn more about your center?
Basically, they can email me at k9profnm@gmail.com, or they can shoot me a text at 505-280-5962. And I can always send them video or text of other patients, and just to show them what we do. And the best part is when you get that eureka moment where the light bulb turns on for the dog, and all the work that you put into them, they can cross one of my courses and they actually walk out feeling better than when they came in.
Wow, fantastic. Laura, thank you so much for today. Learned a lot, and looking forward next time we get together.
Yes, sir. I look forward to it as well.
Same. We are coming right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.